Embrace Active Scar Defense is the only scar treatment clinically proven in multiple randomized controlled studies to minimize the formation of scars after surgery. Your scar is ready for embrace once the sutures have been removed and the scar is closed, dry, and no scabs are present. This is often 10 to 14 days after surgery, but may be delayed due to your personal healing process. Items you may need include a disposable trimmer or scissors, washcloth, soap, alcohol wipes, and a mirror. For best results, we recommend applying at night, at least 2 hours before bed. Gently cleanse the area surrounding the scar with a washcloth, soap, and water. When possible, use bar soap. If your hairline is within the application area, please trim or cut the hair using a trimmer or scissors. Do not shave the area, as this can cause irritation. Next, remove any oil or soap residue with alcohol wipes from the area surrounding the scar. Ensure no lotions, oils, or ointments are present in the area where the dressing will be applied, as this can lead to reduced dressing adhesion. Be sure to allow your skin to dry before applying Embrace. To begin, peel one side of the protective liner away from the dressing by grabbing the gold tab marked as Step 1 and peeling it back. Be careful not to touch the exposed adhesive on the dressing. Peel the remaining piece of the liner, also marked as Step 1, away from the dressing. Using the gold alignment marks on the applicator labeled as Step 2 to help center the dressing over the scar, position the applicator with the dressing facing towards the scar. The gold alignment marks are a reference guide. If your scar is curved or does not exactly align with the marks, this is okay. Pressing firmly activates the pressure-sensitive adhesive. Press and hold the dressing on the skin and rub back and forth along the length of the applicator for 60 seconds. Continue to hold the applicator firmly in place with your fingers along the gold alignment marks. With the other hand, pull one tab to the side and along the edge of the applicator, following the arrow marked as Step 3. While maintaining pressure, repeat this step for the second tab to release the dressing from the applicator. Before removing the applicator, press the entire applicator one more time to ensure the dressing is fully adhered to the skin. If any air pockets occur, smooth them out and make sure the dressing is evenly adhered to your skin. Assure the edges are fully sealed around the dressing. Press firmly and hold the dressing against your skin to activate the pressure-sensitive adhesive. If applicable, when placing the next dressing, overlap the applicator over the dressing that is already in place to cover your entire scar. Ensure the dressings overlap by at least ½ inch for best results. Most scars will require 3 dressings. If the dressings do not overlap, wearing Embrace may be less comfortable. Repeat all application steps for each dressing. Use a mirror for guidance and avoid bending to look at your scar when applying Embrace. Bending over to check the dressing could add excess tension to the dressing and make wearing Embrace uncomfortable. You may require the assistance of others for this application. Each dressing lasts an average of 10 days and is then discarded. For best results, continue treatment for at least 2 months. For body lift, you will need assistance to apply Embrace to scars along your back. To properly position your body for placement, bend forward using a counter for support. Allow 2 hours before replacing your compression garment or wearing tight or restrictive clothing, and at least 2 hours before showering or physical activity. Important things to remember. After application, a minor wrinkly or wavy appearance in the dressing is normal. Redoing the application is not necessary. Minor redness and itching is okay. Embrace is water resistant, not waterproof. We do not recommend taking baths or swimming. Showering is okay. Moisture or condensation under the dressing is okay, such as after showering. If you have redness or irritation around the edges of the dressing, reposition it slightly higher or lower to avoid direct contact with the irritation when applying the next dressing. If you are using Embrace after a surgery and your scar starts to open or ooze, or if you have an allergic reaction or blistering, please consult your physician. We recommend reviewing the video Embrace Removal and suggest removing your dressing the evening prior to reapplication to give your skin a 12 to 24 hour break between applications.